Insulin's connection to cancer. In this video, you'll discover some eye-widening understanding of what promotes cancer metastasis, proliferation, angiogenesis, and why elevated insulin is so dangerous, how it promotes cancers, inflammation, how it elevates estrogen, and it decreases testosterone. And almost no one will tell you about it. Interaction of diet and lifestyle on cancer promotion and reversal. As we go through all the different components, we'll evaluate each one. In this video, we'll look at insulin. What is coming down the road? A tsunami, a wave of elevated insulin and type 2 diabetes. And this is going to put a huge burden on our society and on your health. How do you know if you have elevated insulin? What do you have to watch out for? What are the early markers or imbalances? Number 1, low energy and fatigue. Elevated blood pressure. Also, it should be called vascular inflammation. Elevated cholesterol, triglycerides, LDL, and so on. Weight gain, especially fat and the belly fat. And weight loss, this is the loss of muscle, sarcopenia. Hormone imbalances, PMS, spotting, and so on. Infertility, such as polycystic ovary syndrome. Erectile dysfunctions in men. These are some of the early symptoms. We're going to look at this road to diabetes. And we're going to look at all the early signs and symptoms. In the early part, there's increased insulin produced in your body, yet your glucose levels are normal. Your body is compensating, it's producing more insulin to get the job done, to drive the glucose into your cells. This can also be called insulin resistance. And what contributes to this? Many lifestyle factors such as chronic stress, poor nutrition, sleep debt, lack of exercise, inflammation, and toxicity. However, at a certain point, your body can't produce any more insulin. And what happens is your body starts producing less insulin. And then now, the body can't maintain glucose levels, so they start elevating. So you have elevated glucose levels. This is when you have a fading function, if you will. And far too many are on this unhealthy road, and they don't even know it. So we're going to look at the top part of this diagram in detail. We're going to look at some of the early symptoms when you have increasing insulin and normal glucose. Again, some of the lifestyle factors that contribute to this: chronic stress, poor nutrition, sleep debt, lack of exercise, inflammation, and toxicity. This is the early stage, the compensated stage. In this interesting paper from 2008 in Cancer Reviews, they summarized, simply put, elevated estrogen and elevated insulin promote colorectal cancer. In follow-up studies, there are other papers that revealed insulin promotes endometrial cancer. And other papers from 2010 talked a lot about numerous epidemiological studies have demonstrated an association between increased risk of cancer development and progression of type 2 diabetes, as well as obesity. They also stated hyperinsulinemia, that's high blood insulin. So high blood insulin may favor tumorigenesis, as insulin has not only metabolic actions, but it's also mitogenic at high concentrations. That means it tells cells to grow and divide. Lack of exercise increases diabetes and increases the risk of cancer. In this paper from the Journal of National Cancer Institute from 2009, entitled Insulin-like Growth Factor 1 and the Risk of Breast Cancer, they stated the positive association between obesity and postmenopausal breast cancer has been attributed in part to the fact that estrogen, which is a risk factor for breast cancer, is synthesized in adipose tissue. So it's produced in fat tissue. And obesity is also associated with high levels of insulin, a known mitogen. It causes cells to grow and divide. So what does this really mean? What was their conclusion? The data suggests that high blood insulin is an independent risk factor for breast cancer and may have a substantial role in explaining the obesity-breast cancer relationship. Another current paper had a statement that high insulin levels in women with kind of local regional breast cancer reflect the presence of insulin resistance. High insulin levels have been associated with poor outcomes in breast cancer. They also stated that the development of therapies that target hyperinsulinemia, so the development of therapies that help bring down insulin in the early stages of breast cancer and for the long-term management of breast cancer survivors should be really looked at and developed. And many of these therapies are lifestyle factors. This paper, The Role of Exercise-Induced Myokines in Muscle Homeostasis and the Defense Against Chronic Diseases, that's a fancy title. What did they state? Chronic inflammation is involved in the pathogenesis of insulin resistance, atherosclerosis, neurodegeneration, and tumor growth. They also stated that exercise has anti-inflammatory effects. In this paper from 2010 from stated Diabetes and Cancer, simply put, significant epidemiological evidence has been amassed to suggest that diabetes and cancer are associated and that the link, it appears causal. So what they're really saying is that diabetes promotes cancer. And stepping back, what are some of the components that promote diabetes? Many of which are lifestyle. As a matter of fact, they're lifestyle factors that are under your direct control. Sleep and sleep debt, chronic stress, movement and exercise or lack of, poor nutrition, and so on. This video series is designed to help you explore this and become empowered. These authors also stated that hyperinsulinemia and fat molecules and growth factors and epigenetic changes may be implicated in the pathogenesis of cancer among patients with diabetes. Basically, insulin promotes cancer. Elevated insulin increases an enzyme called aromatase, and that contributes to more estrogen production. Actually, aromatase takes testosterone and converts it to estrogen. And so cancers that are sensitive to estrogen, or the tissue that is sensitive to estrogen, may start growing in abnormal ways. Insulin is an anabolic hormone. It promotes cells to grow and divide. Thus, it can increase cancers. Insulin promotes fat storage and belly fat. And that in turn increases inflammation in the body, which in turn promotes cancers. Increased inflammation leads to increased cancers. That's a net takeaway from this video. And type 2 diabetes and insulin resistance promotes inflammation. As a matter of fact, a very controversial paper came out in 2011 stated, do we have enough data to confirm the link between anti-diabetic drug use and cancer development? What they were looking at here is many people on the road to diabetes in the early and later stages are given medications such as insulin to help control their blood sugar. But they asked the question, are some of these medications that increase insulin increasing the risk of certain cancers? The jury is still out on this, but it's something to be aware of. In a very interesting paper from 2006 in the journal Diabetes Care, they stated 60% of patients with type 2 diabetes have vitamin D deficiency. And remember from the earlier videos, vitamin D is a potent anti-inflammatory. So let's look at hyperinsulinemia or high blood insulin and how it destroys your health. Elevated insulin contributes to muscle loss, which we call sarcopenia. Elevated insulin promotes hormonal imbalances such as fibroid growth and polycystic ovary syndrome. Elevated insulin affects thyroid function and slows your metabolism and may contribute to fat gain. Elevated insulin can promote cancers. Elevated insulin can affect your mood through blood sugar management issues and contributes to Alzheimer's and type 3 diabetes. Elevated insulin promotes fat storage and belly fat storage, and it reduces mobilization and utilization of fat. Elevated insulin increases cholesterol, triglycerides, and LDL in your blood. And elevated insulin is related to fatigue and low energy, and often we don't move as much. As you can see, elevated insulin can really impact your health in many negative ways. And what contributes to elevated insulin? Chronic stress, sleep issues, and something described as sleep debt, not enough sleep, inflammation and toxicity, nutrient deficiencies, chronic intake of the high glycemic index foods. Those are the high GI foods that spike your blood sugar and cause the body to release more insulin. And modified lipid products such as trans fats. These are the lifestyle factors, many of which are under your direct control and greatly influence and impact insulin's production. That in turn greatly influences some of the chronic diseases and illnesses. So in summary, insulin is a powerful anabolic agent, and it tells cells to grow and divide. Elevated insulin promotes certain types of cancers. Inflammation is linked to diabetes, and inflammation and diabetes both promote cancers. And many core lifestyle factors under your direct control have a huge impact on insulin, diabetes, and cancer, and overall your well-being. In the next video, you will explore how low oxygen, something described as hypoxia, contributes to cancer. This will help you better address the root cause of cancer and chronic diseases and illnesses. As cancer affects so many family and friends, please forward this educational video onto them and help them as well. Thank you.